Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over the drug Digoxin, also known as Lanoxin. This is another very important and testable drug that you will likely see in your practice. This drug is classified as a cardiac glycoside. In other words, it will increase our contractility while decreasing our heart rate and conduction. It is given for both AFib and heart failure, where the heart has become an ineffective pump, and it should not be given to patients with VFib. Caution while giving to patients with severe bradycardia and or hepatorenal impairment. Now, in pregnant women, current data shows that it is considered relatively safe. What we should know is that this drug binds to and inhibits our sodium-potassium ATPases in our heart cells. I've taken one heart cell to show you the effects more clearly. Normally, there is a sodium-potassium ATPase and a sodium-calcium exchanger in our heart cells. Normally, the sodium-potassium ATPase throws out the sodium and takes in the potassium. This is important because the sodium, because he's being thrown out, he wants to get into our heart cell. This is important because this is what powers the sodium-calcium exchanger. As sodium comes in, it spits calcium out. I'll say that again. As sodium comes in, it has a revolving door that throws calcium out. This is important because when we take a drug like digoxin that inhibits our sodium-potassium ATPase, it means that sodium is not being thrown out. It gets to stay inside the cell, and potassium will get to remain outside the cell. Now, why is this important? Because I've just told you that this sodium-potassium ATPase is what powers this, the sodium-calcium exchanger. When there is more sodium inside the cell, sodium doesn't want to get in anymore. It's already inside the cell. And if sodium doesn't want to come in, it means that it doesn't have to kick out calcium anymore. Therefore, sodium and calcium get to hang out inside the cell together. Now, why is this important? Because we already know from our previous videos that calcium is involved in contractility. Therefore, if there are higher amounts of calcium inside the cell, there will be a greater contractility. An interesting and important fact is that digoxin also increases parasympathetic nerve activity on the SA and AV nodes. This means that parasympathetic rest and digest activity at the SA node will decrease our heart rate, and parasympathetic activity at the AV node will decrease our conduction. Now, what has just happened? What has just happened is we have increased the calcium inside of our cells, so we have increased contractility, we have a decreased heart rate, and a decreased conduction. Now, it is also important for you to know that Digoxin Toxicity Kit is very common because digoxin has such a small therapeutic range. A therapeutic range is the amount of drug that you can have in your blood where it produces therapeutic effects. Now, once digoxin levels go above 2.4 nanograms per milliliter, we say that that person has digoxin toxicity. Some signs and symptoms of digoxin toxicity are anorexia, GI upset, yellow-green visual disturbances, hallucinations, and general feeling of being unwell. It's known as malaise. Now, we should know that this drug has an onset of about an hour and effects that can last for about 3 to 4 days. Some common side effects of this drug include nausea, vomiting and diarrhea, anorexia, headache, vision changes, and hallucinations. Some commonly tested material about this drug is that the therapeutic range is anywhere between 0.8 and 2 nanograms per milliliter. Below that, and you will not get the therapeutic effects, and above that, you will have toxicity. Now, something also to remember is that digoxin, as we have learned, will increase our contractility, it will decrease our heart rate, and it will decrease our conduction velocity. Now, you must monitor your patient for symptoms of toxicity. If they do have toxicity, you will use a drug called Digoxin Immune Fab, or Digibind. When you give Digibind, it will bind to digoxin and lower the chances of having a toxic reaction to the drug. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.